Total tests that have been given in the state of Maine so far have been 49,599. There's a difference between a PCR test, which I don't know what that is, but there's an antibody test too. But most of the tests have been PCR tests, and there were 4,500,961 of those, and 3,638 antibody tests. And there is some difference there, but the big number for us is, and on Wednesdays, this is when Dr. Shah reports these, is the positivity rate is 5.2% now in Maine. It went down 0.2%. National average is 11% of positivity rates. Massachusetts has a 17% positivity rate. Excuse me, Dr. Shah reported today. And Rhode Island has a 10%. New Hampshire, our next door neighbor, has a 7% positivity rate. And Dr. Shah says ours is going down in the last 6 to 7 days. He said it's at 4.7%. So I think that's pretty darn good. So that's the good news. We're at 5.2% positivity rate right now. Thank you. And Kent usually takes over from here. He and Becky seem to have numbers. I don't know where they get them, but they've got inside sources somewhere.
Super secret stash.
Any comment regarding the data that Charlie has so diligently provided? Okay, I see none. We added a agenda item for this week, and if he does okay, we'll let him come back next week. So Matt, you have the floor, and you're giving us an update from the field.
Well, hi everybody. Matt Buttrick from the police department. Just sort of going to update you on how our Memorial Day weekend went and what we saw and or didn't see. I would say overall, our busiest day was Friday, thanks to the very warm temperatures that we had. It was mid 80s that day, and it felt like the middle of summer. It was also, we were dealing with the Main Beach parking lot flow and rules about, the keep walking, keep moving, and those kind of things. So it was really our first big test day. I would say that overall, our biggest challenge would have been the amount of people at the beach who didn't know or weren't aware that they couldn't sit. We did have the electronic sign at the beginning of the beach, but as Rick Barber pointed out, if you happen to be driving by one of the 4 seconds that it said the main beach was open, but it didn't say walking, running, exercising, etc., you may not have known. We didn't have as many signs in place locally at the entrances to say that. We did have, excuse me, we do have please wear mask signs or wear mask signs and social distancing reminder signs. But one thing we're going to work on is if the rules stay as they are, putting up signage that indicates the specific rules, much like we're preparing to do on the Marginal Way coming up here for Monday. We had between 2 to 4 officers and community service officers on the beach or in the beach parking lot throughout the weekend. They made contact with lots of people who were sitting down, not continuing to move. Some of those people had exemptions from those being able to stop and sit, and others were not aware and moved along. We met no resistance from anyone as far as who we talked to as far as not moving along or not having an exemption. I would say that the amount of people wearing a mask, I would say, was fairly low in our experience. But having said that, the beach was never filled up like it is in the summer. So, in the summertime, you go down there and at the Main Beach ramp particularly, it's not an exaggeration to see you can't see a grain of sand in that area, particularly when the tide dependent. It was not like that. I would say that family groups or groups of people that came together were staying together, and non-family groups or people that didn't know each other, I feel like, or what we feel like, they were observing good social distancing from one another. We do have our CSOs who were assigned down there were asked to take pictures every couple of hours just to document what they were seeing or what they weren't seeing. And most of those pictures paint a pretty good picture as far as distancing. I'd say a very good picture as far as distancing. The biggest social distancing challenge that we saw at the main beach area is obviously how you get on the main beach by the Norseman. That is sort of a small area. The other area where it's very challenging to do any kind of distancing are not just the footbridge or footbridge beach, but the overpass, the crossover to the dunes is about a quarter as wide as the footbridge beach is. So I would say that was another area where people, they have no option to social distance. There are mask and social distancing reminders on both ends of the beach and then in the middle where those cutouts are. But I think one of the hurdles that we're going to have to overcome is the impression that we're outside, so you don't need a mask. I would say just like sitting outside or walking outside of Hannaford, the first thing a lot of people do is they just take their mask off and take a nice breath of fresh air. Or you see people before they go into the post office or something, they put their mask on, but then they take it off immediately. And I think when you can social distance yourself from other people, whether you spread out on the beach or whether you move away from the main beach, I think, per the governor's order, when you can create social distance, I think that taking the mask off when you can is appropriate, but other times when you can't, I think we need to do a better job as far as getting that message out there and educating people as to the reasons behind it. But I would say traffic volume, as far as motor vehicle traffic, was down significantly in town. I can't remember since I've been here, the last Memorial Day weekend, that we didn't have significant traffic backups, say Thursday and Friday coming in, and then Monday leaving. The same was borne out on the turnpike. There were no traffic backups to speak of on 95, and that is absolutely unheard of for Memorial Day in Maine. And I know that one of everyone's frustrations has been the perceived or the actual lack of compliance with the 14-day quarantine for out-of-state visitors. And I will grant you that there's many out-of-state day trippers who have come up and likely in violation of that quarantine. But I think we also need to focus on the huge number of people who are abiding by that was borne out in the statistics for traffic alone. So that's all I have as a report from the field. Happy to answer any questions or anything you might have, guys.
Thank you, Matt. Any questions for Matt, please? Terry Ann.
Matt, last week we chatted a little bit about PPE for visitor services. Can you tell us what the status of that is?
Sure. We took delivery of quite a bit of PPE over the past week, most of it specifically allocated or for future allocation to visitor services. So we're currently working on basically rollout plans for visitor services as far as equipping each individual visitor services person and supervisors and booth with the appropriate materials that they need. The town's implemented a pre-work checklist that you have to fill out as far as symptoms. We have thermometers that we received this past week that are being doled out to individual departments for temperature checks before people come back online. As you know, the town hall is opening back up June 1st. So we're working towards making sure all of our staff in the town has appropriate PPE supplies and all the things that go along with it. I know we have some meetings coming up with visitor services supervisors where they're going to be talking about some of the logistics of the rollout. But I would say from a PPE perspective, we're in much better shape this week than we were last week, thanks to Amazon and some other distributors who have come through.
And parking, the visitor services, what's the current plan for parking? Paid parking.
I don't know that there's no definitive plan yet that I'm aware of. That I think they're working on a plan for paid parking, but I think that that's a decision that is with the town manager and the select board as far as when that might be appropriate. That's at least my interpretation is, I think you'll see something forthcoming. But I think it will be in June when the actual stay-at-home emergency essential travel only order expires. I think then you're more likely to see something starting early June.
And bathroom protocols, are they designed yet for?
That, so as far as cleanings and number of people,
Yeah, just whatever
So
protocols that are going to be developed, you know, the blowers and all that kind of stuff.
they're still working on the actual protocols for those. The admin services, Darren has taken or has a rental unit, and he's taking delivery of some additional cleaning units that do sanitization. We're working with some of the CDC guidelines for best practices for public restroom facilities. And we're working on developing cleaning checklists, both for the staff who clean and as well as the patrons, so they could know essentially what it is. As far as capacity in bathrooms, we haven't talked about yet, but we will before all the other bathrooms open, about how or what we're going to have to limit the capacity to. And it's a particularly discussion for the main beach bathrooms, which have the women's side has a much larger capacity than it had last year. So it's one of those things that we'll have to look at square footage again. And before it opens, we'll definitely make sure that we've undertaken the same essentially analysis that a business would take, and we're going to use the best practices from the CDC.
And the blowers also, because the blowers won't be able to be used. Has that been addressed?
I'm not sure. I'll find out. I haven't talked to, or I don't know. Darren may have very well figured this out, but it hasn't come up on my radar yet. But I'll find out for you, Terry.
Thank you.
Any other questions or comments regarding this particular part of the agenda? Kent.
Yeah, I have a question. I don't know, Matt, if you're able to answer this. We're trying to get our hands around the day tripper volume. I was wondering if there's any way to quantify the traffic flow into town. We've got the parking lot data, but you know, any traffic flow in and around town coming in from either end and staying for a while. Do we do any counting?
So I have, sorry, I didn't mean to interrupt, Ken. I have traffic counts coming into town from the south. So I can give you total traffic volume or break it down by hour, a day of the week, whatever, as far as coming into town. I don't have anything counting from the north, but I think a lot of our volume comes from the south. And I can give you that. And I can also give you a comparison to sometimes we had it in the same spot last year, similar times of year, just to see if that's something that you could make extrapolate any useful data from.
Great, thank you.
Sure.
Pam was next, and then Charlie.
Thanks, Matt. You have the volume, but you don't know if those people are day trippers or they've been here quarantined for 14 days. Is that correct?
I don't know anything about them beyond their vehicle that goes. Yeah, I don't know if they're main residents. I don't know if they pre-quarantine. I don't have plate data for any of them.
You don't have plate data. You just have the number of traffic data. Okay.
That's
and I did talk with Pat on and today on a couple subjects, and one of them, she felt that based on her current projection, she was looking at opening the parking lots in mid-June, somewhere between around Father's Day weekend, depending upon getting the credit card machines ready to go and everything, and all the protocols in place. So, and again, that's a moving target.
Okay, thanks.
Charlie, you had your hand up. Charlie, you have to unmute.
Just wanted to check that the numbers I saw, not for town particularly, but for the entire state for the weekend, and others of you may have seen it, the traffic was down 53% coming into the state from the south. And well, it certainly felt like Algonquin was down a lot more than 53%. When I drove down to the beach, I didn't see 20% down there. So, maybe it's me. Maybe I just went at the wrong time. I don't know. Did you notice that, Matt? Did you think there were, it was down only 50% or so?
I would say, to me, it looked like it was down more on the weekend, and I attribute a lot of that to weather as well. So Friday was beautiful, but right on the coast, the other weekend days weren't quite as nice. So there may have been, I'm sure obviously the 53% reduction is an accurate stat from the Turnpike, but a lot of those people, I'm guessing, would bypass the beach when the weather isn't perfect. I would say that 53% down would be an accurate statistic for Friday with the beach. I'd say it would have been about half capacity as we normally would have been on the Friday of Memorial Day weekend. But I would agree with you, Charlie, that the rest of the weekend days appeared to be less than 50%, at least here.
So the other thing I wondered about is that, in the press conference today, the governor was there and she was pressed once again about that 14-day quarantine. I'm kind of wondering, and she hasn't backed off it. She says that remains, and she's going to keep it that way, working with the other states. And she says, she wants to see how it goes with the other states, and if things start opening up more and our positivity rate keeps going down, then possibly she could look at changing that. The question for you is, how are you going to monitor that, and how are you going to know if somebody has or hasn't quarantined for 14 days, Matt? I'm assuming that's going to be left up to enforcement, up to the police. I don't know how else. I don't know where else it's going to stand.
So I think locally, we, as far as in Algonquin, generally we would be the enforcement arm for that. What we've been doing up to this point is we've been, if we have contact with someone for another reason, another violation of the law, a traffic violation for which they get pulled over, then there'd be an inquiry as to if they had out-of-state plates or an out-of-state license. We'd inquire about the reasons for being here or where they were living, quarantine, etc. We're not making proactive stops on out-of-state vehicles, and we're not contacting people proactively who we know are from out of state and checking on what they're doing. To this point, we've been relying on other contact, and that being a line of questioning that we ask, or neighbors or other businesses making us aware of what a perceived or potential violation of the quarantine. And and if we're made aware by a neighbor, we have an information packet that we're giving out that explains the 14-day quarantine. We also explain to the person who is given the packet that it's actually technically a violation of the law. It's a crime to violate the 14-day quarantine. And I don't think people realize that the violation of the governor's executive order in that effect is technically a crime. We obviously haven't issued any criminal charges as such. We have had discussions with people about what happens if they don't comply, and we've given them information as to the next steps that we would take. I'd say, the Algonquin Police Department is a community-oriented police department, and we focus on education and our community. And I'd say the overwhelming majority of people that we've had contact with, whether it's a business or a renter or someone from Massachusetts, have been incredibly compliant and understanding of the rules, and have been forthright with what they're doing. And once we make contact with them, they either agree to quarantine or they leave.
Thank you, Matt.
Matt, I have one question. This is Pam. I know it's executive order, but it's not, can you actually write a citation since it's not a law passed by the legislation? A couple people have asked me that question.
Yes, we can. It's a special criminal charge that we are allowed to write. It's a Class E crime to violate the governor's executive order. So it is a violation of the law. it is a criminal charge, and all police officers in the state have been empowered to enforce that provision in the executive order.
Thank you for clarifying that.
Sure.
Any further comments on this or any other issue for Matt? Okay, I see none. Thank you, Matt. Appreciate it. I think you get to come back next week,
Thanks.
whether you like it or not. Okay. Next on, I believe Pam, you're going to, we're in subgroups now. We're in at risk, Pam. You were going to take that?
Yeah, Charlie and I talked earlier, and I was going to take this one. It's a basic review. We all know that people over the age of 65 suffer more serious illness from COVID-19, but people of all ages that have underlying medical conditions, particularly those are not controlled, are also at risk. People with lung disease, heart disease, HIV, AIDS, severe obesity, diabetes, liver disease. I mean, I could go on and on. I think as a task force, what Charlie and I talked a lot about was we can't overstress the need for education and for the public at large to protect themselves. If you are in any of these risk categories, you should stay at home if possible. You know, obviously washing hands, we've talked about, avoiding close contact, social distancing. There are great signs all over town about social distancing. There's markers on the street for social distancing, covering your mouth and nose. And one of the things I found with most people do that, but every third or fourth person has just their mouth covered and not their nose covered. So whether it's a mask or a cloth covering. And like our mothers and fathers always told us, you know, cough into your elbow or sneeze into a Kleenex and get rid of it and wash your hands. So those are just sort of the basic things that I think that everyone needs to know about. But when we were talking about this, we talked about the education piece of this. Our website, we would like to see if it could be updated in such a way that this educational material is out there. If you go onto the section that says COVID-19, the first thing you see is the governor's proclamation in March. And that probably needs to now be archived, and newer things should be moved up. There's nothing on there about beach openings. There used to be a banner on the top of our website that said the beaches were closed. That's gone now. And actually I had Pat help me find it. It's under beaches and beach passes that talks about the regulations and what is included in going onto the beach, because there's nothing anyplace else that says you can't sit on the beach. So it's in that section. Now, intuitively, I would have never gone to that. I'd have done beach passes, and that's all I would have looked at and not beach. So I think, I don't know, I don't think there is a quote unquote true webmaster. I know that Jordan Friedman does a lot with the web, and I'd be willing to just work with him and kind of put up some of this educational material, you know, or move around what's on there now for the older stuff to go down and get some of the data material that both Rebecca and Kent are providing to this task force and get it up on that site too, so people could see that. I don't think you can overstate, you know, the things that need to get done. And sometimes you have to say it over and over and over and over. It's kind of like telling your kid, don't do this, don't do that, don't do this. So I think the more places we can get accurate information, and the website being one of them, is that. So that's where we're recommending, is to have a more robust site under the COVID-19 part of the town website. If possible, to have some you know, graphics up there, something that really sticks out and says, you know, this is what you should be doing, this is what you shouldn't be doing. If you're at risk in this category, these are the things you should say. So that's where we're at right now.
Okay, thank you, Pam. So one comment I have in context with this is, actually, we're charged not with implementation or enforcement. We're charged with making recommendations and to some extent monitoring. I did hear you volunteer, though, that you would get
Did.
involved in the website. So I'm going to volunteer you for the website. See, I think there should be some small advances where we as a task force do matriculate into helping with some implementation. And I won't get into enforcement because I don't think that's really what we should be doing. We have a fine police force. But certainly in terms of implementation, if we can help the website be more lucid when it comes to COVID-19, I think we should help drive that a little bit. So I don't see us having a complete, we're not involved in implementation. I think we should be looking at where we can be involved in implementation to help the greater good. Rebecca, I saw your hand up.
Maybe our minutes could go up there too, because I've seen on the chat questions, persons.
Oh, excellent,
the last-
excellent idea. Yeah.
And we've already discussed something, so.
Okay, great. Kent?
Do we know what the traffic level is on the website? Do we know who's actually going on the website to see things like that? And I understand the website is just one avenue for getting more information out and educating and raising awareness. Alice will probably talk about some of the signage ideas that we talked about on the chamber committee. But we're finding at the Playhouse that we're getting very little traffic, a ton less traffic than any other year going through our website, because right now we have nothing to offer, right? So just wondering if it is a good place to put information, but who's going there, how many people are going there, and what are the other media outlets to raise awareness and do the education. And keep in mind that the attention span of an individual is about 17 seconds. And
Yeah. I don't know if we know that, but I know that Jordan might know that, since he's been monitoring that. I know Pat's been putting up a lot of stuff on the website too, and we don't have a dedicated website master at this point in time. So I know we have the ability to do some scrolls across the top, and even if if you were coming from out of state and you wanted to know if Algonquin Beach was open, you could have seen the scrolling. Algonquin Beach is open only for walking and jogging and no sunbathing. If nothing else, that would have been up there. But I'll find out the answers to those questions.
Okay, Charlie, you have your hand raised. Charlie, you're on mute. You're still on mute. Fine, everybody on
There we
iPad.
go. I've got it. All right,
Okay.
can you hear me now?
Yes.
Sorry about that.
Yes, Sprint man, I can hear you now.
So I'd like to pull Alice into this conversation, because I know a lot of people coming to Algonquin go to the Chamber's website. So Alice, are you there? And can you give us some idea of what kind of numbers you're getting? Because I know besides the town, I bet you get more people looking at your website than the town does, I would bet.
Well, we actually, right before all this came down, probably I think March 8th, one of the projects that had been on hold since I got there, that my predecessor was working on, was launching a new website. And so March 8th, I started the conversation with the company that we're working with, and then this all hit March 13th. So we're back on that now. Our team is working actively with it's called Growth Zone. It's basically a chamber organization to develop a new website. We hope to get that launched in the next couple of weeks. Our current website is not that functional. So we're looking forward to having something that's much more dynamic and much more easily. And this is a major focus of what that new website will have, is beach information, safe social distancing, face masks, but all wrapped in a very welcoming, we miss you, we're glad you're back kind of messaging. So hopefully you'll see that within a couple of weeks. We're not going to wait till it's fully done. We're going to soft launch it and get pages out as they're ready to go. So that's a major focus of what we're working on right now, as well as the signage that Kent mentioned, and I can go into that kind of when we get into the business subgroup part of this agenda.
Thank you.
Rick was next, and then Terry Ann.
Yeah, I think that the chamber has an opportunity So Michelle was just saying in chat about Parks and Rec could actually do some sharing too. I think the key thing is we have, and I think Pam, if you're up for it, to keep it updated on the town's website, and then use these other sources to link to that same website so that you don't have, oops, we forgot to update this over here. We forgot to update this on this group. If everybody's just linking to the one site, that'll increase the traffic for that. And I will say that based on the number of questions that we're getting through the COVID-19 site, that people are obviously using the website, but they're looking for the answers that they can't find. So Pam, I think that's wonderful that you could put that together a little bit easier so that we know what the beach is closed and what's not happening. And it'll, but the fact that they can find that means that they are using the town's website.
Hey, Bob, can I interrupt real quick and just, Jordan Friedman raised his hand. He may have website information for you all, if that's something you'd want to hear.
Yes, bring him on. And then Terry Ann.
Jordan, if you unmute yourself, we should be good to go.
Can you hear me?
Ken? Oh, Jordan.
Okay. Typically, where I work for the town, anything that we change or put up should have the town manager's approval. If you can work it where she'll allow us to do it with our good sense, and then she just monitors it, fine. I can get you some numbers. I haven't been lately. I usually do an end of the month statistical check, but I can look at it closer and see exactly of all the people coming, is this more than last year? And it should be. And I can usually find out where they went to, what pages they went to look at. If you can sort of put together a list of what kind of statistics you want to see, I can get them and I'll get Pat's approval to give it to you.
Thank you, Jordan.
Jordan, thank you very much for that. I had a quick call with Pat today, and I think she seems to be quite receptive to doing something like this. She said that she didn't have a lot of time to do that. So if we came with a coordinated plan to her, I think would be okay. But I will go through her first. Thank you.
Okay, all right. For the longest time, I was upset that no one was giving me more material. So I finally asked Pat, please take a couple of minutes and get rid of some old stuff and give me some new stuff to put on. And she did, but she is overworked so much that if she would agree to let us do it on our own, then that would be great.
I will revisit that conversation with her. The conversation that I had with her today led me to believe that she was very much interested in doing this, provided, you know, that she didn't have to do all the work, and I don't blame her. I would like to talk with you offline just a little bit about the mechanics of the website and how we can get, if there's an ability to get certain graphics up there and certain things so that we could make this more user-friendly.
Sure, fine.
Terry Ann, you were next.
I'm just throwing this out. Since getting folks to engage in protecting one another by social distancing and wearing face covering when you can't, there are a lot of websites around town and a lot of Facebook pages that businesses have, lots of different social media content that exists. And if we could engage folks in helping one another to protect the town and folks who come by putting a link to whatever we put on the town page, so that wherever I go, so if I went to Rick's Facebook page for Moon Over Maine, or on his photos or whatever, want to know about the beach and put a link in, if we could have as many people as possible who have Facebook pages, who are visited by people from out of town, to link to one place. That could really amplify the impact of our messaging. So it's just a wild idea.
Okay, thank you. We've had a lot of discussion here. Anything else? So I think Charlie, last comment, Charlie.
All right, I just want to remind people that being part of the at-risk group and mostly looking after the elderly, there's what they call a digital divide. And the elderly seem to fall into that digital divide. I think at some point we should discuss having the town send out something through the snail mail to each family in town, because there are so many of us that don't do Facebook. You know, I got a new MacBook Air here that I still haven't even set up yet, crying out loud, because I'm concerned about, you know, how to do it. The last time I set up a computer, I goofed it all up. So I'm not really good with technology. And, you know, I've gotten so as I can work my cell phone pretty good. But what I'm thinking is, you know, there are some people, you know, awful lot of elderly also tend to be isolated. So maybe we ought to consider the town sending out a mailing of some sorts to everybody to let them know what we're up to, especially at this point, because we're you know in a you know we're in a situation now where the tourists are actually going to start coming. So that'd be one thing I'd like to see done as well. The Facebook things are all nice, but there are some of us who will never see any of those, and an awful lot of people that won't go on the websites. So that's my comment about that.
Okay, thank you, Charlie. I think it's a good point. I don't think the town's got the bandwidth right now to manage that, but maybe we do. So Pam, you are now going to work on the website. You're the webmaster from a COVID-19 perspective. Please think about Charlie's snail mail, which is a nice term, option, because I think he's right. There are a lot of people who just don't do Facebook for whatever reason. Okay, good. I think good discussion.
And Terry should work on that snail mail too, because Terry's very articulate, so.
Okay. You guys are getting work to do, so let's make sure we do our work. Okay, find the data. The data people have the floor.
So we have some data and we have a bit of news to share. So I'm just going to go through a quick news update and talk about some stats and some data trends. And then Becky's going to remind us of the data sources we have as we're thinking about monitoring density and trends and monitoring the at-risk population. So Governor Mills put out a press release earlier this week about expanding contact tracing to limit the spread of COVID. Just a general overview of what contact tracing is. It's the process of identifying, assessing, and protecting people who've been exposed to a disease to prevent their transmitting infection to others. This contact tracing, together with testing, enables the state to identify, investigate, and isolate individuals with COVID-19 to prevent its spread in the absence of effective treatment or a vaccine. She outlined a three-pronged strategy for implementing or for enhancing contact tracing in the state. The first prong is increased personnel. Currently, the Maine CDC has a contact tracing team and case investigation team of about 30 people. She intends to, starting on June 1st, quadruple that force in 2 to 12-month engagements, depending on the direction of how the infection trends go. And she's doing this increase through training up some qualified staff and also reaching out to contractors. The second part of her strategy is to deploy the Sarah Alert system. This allows individuals who have been diagnosed or potentially exposed to COVID to report daily symptoms through web, text, emails, and calls, and provides real-time insights and increased reporting capability to support containment of the virus. It also enables hospitals and health systems to conduct contact tracing for their own employees. And then the third part of her strategy is expanding social supports. This is something I think Ogunquit has been doing quite well all along the way. But as we all know, staying apart from people for a period of time to protect the public health is a challenge, especially for those who are struggling with housing, food security, transportation, mental and substance use disorders, access to affordable health care and child care, on and on. So they're expanding these social supports for people isolated or quarantined because of exposure to COVID-19 by contracting with community action programs. And she's also engaging the Wabanaki Public Health for support to Native Americans, and also reaching out to Catholic Charities, which operates the state's refugee program to help with language translation for non-English speakers. So there's a lot going on there, and coupled with the increased testing that we've seen over the last several weeks, and that testing still continues to increase. I think it's a good strategy to put a lid on growth of new cases. Just some more stats and factoids about hospitalization. As Charlie said, there are 59 hospitalized as of today. 25 are in critical care and 14 are on ventilators. The capacity for critical care beds is 157, and the total critical care beds is 406. We have available ventilators of 232 and total ventilators of 315 and alternative ventilators of 439. So there's still capacity there, as Charlie said earlier. So things are good there. Becky and I started looking at cases by age group because we were trying to see what was going on in those at-risk populations that we've been focused on. And we found something interesting. And some of this, of course, is tied to the increased testing. We're still seeing growth in the number of new cases, but some interesting trends that I didn't expect to see, and maybe somebody on this panel can shed some light on why the trends may be what they are. But in the under 20 group, and these statistics, I looked at a period from April 15th to yesterday. And in the under 20 age group, the number of new cases rose 453%, up to 90. They're now at 98 cases. They started at 50, now 98. So that's the law of small numbers, but 453% is a pretty rapid growth. And if you look at this if you plot this out, it looks like a pretty steep curve. Also interesting was the 20s and 30s. Those age groups grew 276 and 267% respectively. Again, some pretty steep curves there, the steepest of any of the curves in the growth of any age groups. And then it goes down from there. 40s grew 208%, from 251 to 327. The 80 plus age group grew 135%, from 179 to 235. The 60s age group, 114%, and the 70s was the lowest group, grew 95%, from 184 to 228. So the takeaway there is, if you look at these plotted out over time, and I did it, I'm looking at a graph right now from mid-March through yesterday, and just looking at the shape of the curve for each of these lines. The age groups that we were worried about or that we're focused on seem to be flattening out more quickly than any of the other age groups. So I just thought that was interesting And we'll dig into more of that to see what's actually happening there. Looking at the major changes in age groups by percentage of total cases, 60s and 70s age groups are declining as a percentage of the total cases, and that makes sense based on what I just said. And the 20s and 30s age groups are increasing at a rate much higher than that. So offsetting those two groups that are declining. So some interesting stuff that we'll keep an eye on and see how that develops for the age groups that we're most concerned about. But that's what I have for this week. Does anybody have questions for me before Becky?
I do, just a quick one. I found a similar graphic and it was on one of the local TV stations. I think it was Channel 8 that did that. It was a pie chart and it follows right along with what you're saying. And I don't know the source. I think it was Maine CDC, and it went from March 29th through May 26th. And the 20 to 50s, the number of cases were between the 20-year-olds to and the 50s was 64.16%, which surprised me because the number of, we keep talking about the older population, the 60s through 80s was only 36.85%. And it kind of, I looked at that twice and I added my numbers up twice and I said, wow, that's not what I had expected to find at all. So there's other data out there. So that supports what you're saying.
Yeah, so.
I think Dr. Shaw about 2 weeks ago said when they were about to increase the testing by 2 or 3-fold, and they were going to take off the limitations on the testing protocol and who got tested, and he warned that the numbers would move in different directions. Up to now, we've been testing those at most risk and those with most symptoms. But when they freed up all these additional tests, this is what he said, he expected to see changes in how the makeup of the results were going to look, because now people could order tests in a more free-flowing way, and other people who would normally not have been tested, say 3 weeks ago, can get tested now. Particularly asymptomatic cases were probably going to go up. People who felt bad but feel really bad. But that's what he was saying. So while I didn't think it would be this dramatic in terms of percentages, I think we should have all expected when the IDEX test came online, we would see some of this. But it's good to know. I worry when we see something like this and we start thinking, well, the age group, the older age group, which we're trying to protect the most, not doing so bad. Well, you got to remember that's where the death rate comes in much more dramatically. So.
Right. Yeah, and I think it'll be interesting too, and we're looking for the piece of data on how many tests per age group were given in those periods too, to see if that's, to your point, Bob, if that's what's causing these increases like this.
Okay, Charlie, and then we'll go to Rebecca.
All right, the comment I have about the numbers going down for the older people is, I think we as older people are taking this more seriously. If anybody saw the news this weekend about that Missouri swimming pool gathering there had to be 300 or 400 people, but they were all in their 20s and 30s. I mean, they didn't look like it was anybody over 35 in there. And when they were interviewed, they said, well, if I get it, everybody gets it. I don't care. You know, it was like that kind of cavalier attitude. Whereas I don't think people in their 60s, 70s, and 80s are that cavalier. I know people, people I know are not anywhere near that cavalier. So I think that might have something to do with the spike in the 20s and 30s. The other reason I think is that, over the years, we've learned a lot more patience than they have. In my 20s, I don't think I could have been this patient and kind of sat home this often and felt okay about it. I would have been, jumping out of my skin, I think, in my 20s. So I understand why they are like they are. But the other thing I wanted to mention, and I didn't hear you say anything about it, Kent, is that I heard over the weekend that York Hospital is opening a mobile testing unit on June 1st. Have you heard anything about that, or has anybody on the panel heard anything about that, and how's that going to work?
Alice has got her hand up. Maybe she has an answer to that question.
Yeah, I got a press release from York Hospital yesterday that I'll be happy to share with everybody. So we're on their press release database. So I'll forward that to everybody. But yes, that's true.
Thank you. So Rebecca, you want to follow up then on the data group?
In terms of the 4 agenda items, we wanted to reiterate the data that we know and maybe address other ways we could collect additional information. So in terms of monitoring, we know the marginal way counter, we know the parking lot numbers, and we could get counts on lineups from businesses perhaps. This might be less true with the restaurants not opening inside. In terms of town density, we know bed capacity, where overnight visitors come from, the number of parking spaces, and we don't have much information on day trippers like Kent said, but now there's this idea of traffic counts from Matt, and also the number of cars on Route 95 give us some idea of the influx of visitors. In terms of phase 2 and 3 on the beaches, we could get reports from visitor services, CSO, police, and lifeguards on public behavior, and also public works on bathroom lines when they open. And in terms of the at-risk group, we know that there's some worrisome data on potential crowds, such as the incubation for COVID is 4.2 days from exposure to symptoms. And so tourists may arrive well and thereby infect people in the meantime. The CDC estimates 20 to 50% of contagious people have no symptoms at all, so they pose an even greater risk. And we know that transmission can occur within 8 to 14 minutes of exposure. The other issue is that if you get seriously ill, you spend an average of 16 days in the hospital. So you take up a lot of healthcare resources and unfortunately are unlikely to have a very good outcome. So hopefully there's a connection between people appreciating the risks and adapting their behavior, such as wearing masks and being good about social distancing. We can also get reports from EMS and the lifeguards on first aid and emergency calls, and watch the trends in the number of cases and the number of occupied hospital beds. So that's our summing up of where we can get more information.
Thank you, Rebecca. Any further comments for the data group? The only other comment that I would have is, and it's probably not the right time, but I'm starting to hear a lot in the media about what are the effects of not being able to go out and do things in terms of mental health, suicide, and some of those things, domestic abuse. You know, at some point, we're going to start seeing more of that. I don't know if we see that in our locality, but it's certainly starting to become concerning to some people. And you know, it's I think there's probably something we need to start looking at down the road. Is that going to be an effect? And is there some recommendation we can make around that? Perhaps it's not apropos to our locality, but it is something that's out there. People are talking about that. I wondered if the data people had any comment on that.
Unfortunately, privacy becomes a big issue. And even with the age data, we don't know the source of people's infections. So are the younger people who are getting infected, are they all workers who are being tested now? You know, are they working in a nursing home or a packing plant or a prison? Unfortunately, we don't get that information. So maybe as we get more information about the town, I'm not sure still how we would get mental health information. The police might know about domestic violence more than any other source.
Charlie, last comment on this subgroup.
You bring up the mental health aspect. As a social worker, I listened with intent yesterday with Jean Lambrew, the commissioner of DHHS, who brought up the fact that they are expanding, the state of Maine through DHHS is expanding the social supports to people in, especially people who are quarantined and in isolation, and people who are at most risk, because of the fact that, you know, some of them are scared to death to go out. And she said that they will be hiring a point person for that very shortly. I don't think they've done it yet. That was just yesterday. So they're really keying in on the mental health aspects of it, Bob. So I think we'll have more information about that down the line. And they've been thinking about, you know, what kind of people they're gonna put in and hire, and also get to volunteer, like they have, sort of like they put together a small army for the contact tracing. And they're gonna try to reach out to people who they understand might be isolated or exposed, not exposed, but in danger of possibly, you know, having a more difficult time than most, especially people isolated and people who are at risk. Thank you.
Okay, Charlie, thank you. Rebecca, quickly. if
I
you
just
can.
think that financial pressure on people may actually create way more problems with depression than the actual risk of infection. And so I'm not sure how we get more information about that, but certainly watching the numbers of unemployment, maybe we should start reporting some of those numbers as well.
Okay, thank you. I don't know what role we have to play. Maybe there is some educational role. We're talking about education a lot. Maybe we have some educational role there, but for now, it's probably not appropriate for us to be working too closely on that. Okay, let's move on to public health and Terry Ann and group and team.
I'll speak to the public health. Just listening to everybody's comments today, we're seeing a clear situation of kind of fragmented information. It's out there. Whether people are absorbing it or not, it's ambiguous at best. So what Terry and I were speaking of is in the public good is to kind of narrow this down to basic tasks. Masks, social distance, those are our predicate. Those are the things that we must have to have. So, you know, when you come into town, you know, it says bingo. Now it says bingo, wear a mask. I mean, whatever platform, Facebook, wear a mask. On the men's room at the club, wear a mask. Everywhere, every place, and we're consistent with that. We allow ourselves to work on the smaller issues that are confusing people. Like I think that in concert with this, we should move to phase 2 at the beach, open the beach fully up. And so all the rules that everybody knows the beach for, you know, no dogs, no bikes, get out of the dunes, leave the plovers alone, those concentration of rules, and even the lifeguard lines, where the ball players, all those rules that we've, as Algonquin beachgoers, have known for a long time are ingrained. So we know those. We're not gonna have to worry about no sitting. You know, again, we're just concentrating on social distancing and your mask wearing. When we see these restaurants open, I think they're modeling, and they're all the workers wearing it. We'll start modeling. I think the more we model it and move forward on these simple tasks, the information won't worry about whether you can sit on the beach, because you can. You know what I mean? And we'll start working this conflict resolution out between individuals. We're gonna come down the street where someone's gonna be walking up the street and they're gonna have people meet. Whether they have masks on, whether they do the proper social distancing, these things will have to work themselves out. If we're clear in our mandate that we clearly, like, this is the only things we're asking, mask and social distance. If you can't do those things, well, then you're kind of playing yourself out. And that's kind of, that's where I think we'd work best. This is more of a 10,000 foot overlooking of this thing, more than the management of, you know, bathroom protocol, the footbridge protocol, all those things. We just be clear on our mandate, and then we could fix and pick and choose things that we find to be not working. And also in a sense of unity, a sense of, hey, you know, come on, I got to wear a mask. I'm going to wear it, take it off. But when someone's coming, I got it. Even if I'm not wearing a mask, look, I got my mask with me. I'm kind of playing the game. I'm part of the team. For the restaurant owners, and the business owners, you know, they're going to want to promote that so they can have safe things happening, you know. And again, to speak to Charlie for a second, when he mentioned the people in the Ozarks, we don't know what we're going to see in businesses, when they can congregate, when they can come in, and when you're going to say that's enough. When are you going to tell your business, like, you don't make any more money tonight, you know, even though you could probably fit a few more people in? Like, we want to promote just positive energy. And as long as you're wearing your mask, we're not worried about someone trying to break the game or cheat the game or try to make a nickel more here on the one night of the week they might be able to make a little nickel. You know what I mean? It's gonna be unison. And then we can work on things like, what happens if a restaurant does have an outbreak? What's the protocol through the state? What do we do as a town to make it a safe environment? You know what I mean? And help those restaurants that got, like, it would be awful for any of these places, any place, to have to shut down for 2 weeks at any part of this season. They're already getting kicked in the shins enough. So again, concentrating on the signage of just wear a mask, you know, social distance, use your hand sanitizer when you can. I'm not even worried about that. Again, mask, and then allow the beach to open up. Allow people to socially distance themselves and work this conflict out, and, you know, and then go from there. I don't think there's anything else I have to say. But it's more of a public health and be unified on that. So not worried about, you know, no sitting on the beach. No, wear a mask or social distance. That's on that sign. That's there. That's everywhere. We're all in unison on it. I mean, I was on the beach the other day with my boys. I love throwing the frisbee and the football with these guys. Been doing it forever, and I didn't, and it was killing me. I was like, what? I made there's no one around. I had all the excuses in the book. And I knew I could do it. I could do it. The Beastie Boys were going to take it. But no, you just can't do that. That's my commitment to other people, that I'm going to show, hey, as long as these rules are in place, we're all in it together. Grab an oar, we're going this way, start rowing. That's all I got to say. Thanks.
Thank you, Buzzy. So what I'm hearing from you is, and just want to confirm, is it sounds like we're moving a little closer to helping with implementation of these things, which I think it's appropriate, to the extent that our help is requested or asked for. You may have to give me direction on that going to the select board. Go ahead, Buzzy.
Oh, the thing what I'm also is, by allowing the rules to be lax, and we allow this to deal with each other individually and personally, the people that do the things, I don't want to say bring a dog on a beach, but just for those things will stand out. That egregious behavior that's not part of will stand out. And so we're not giving tickets to people, but, you know, we'll publicly shame them a little bit. There's something to be said about shaming people, you know. I mean, it's how we do things. It's a society. But I without, like, you know, browbeating, we open these and concentrate on the basic rules that we can govern and show public health. And then again, we're at the mercy of the state. We do not know which way this goes. Earlier we spoke, Rick earlier today said, we can mitigate the size of these crowds by which parking lot. If we open the secondary parking lot, then we're expecting more people in. Or we could just open the main parking lot down the main beach, and that allow us to know what that metric is. If the tie at 3, we'll understand that, you know, we can move with that. But on the same token, if the rules are the rules, we're all in it together, they'll understand. And again, people are going to be going to the beach this time like never before, coming down, go, wow, the beach is packed, turn around. It's never happened. Most people go on the beach, oh, it's packed, let's get in, I can't wait, you know, let's go. It's going to be a little different. And people, and us locals, regulars, we may not be going to the beach on Friday, Saturday, and Sundays. We may be using the beach on Monday, Tuesday, Wednesdays on the downtime. And then as a public and as a community, we can all see those things that, you know, oh, you know, hey, I take my morning walks on these times. And again, we fit into this to make us a healthy town. Anyways, again, I'm running on, but I'm sorry. Thank you.
Rebecca.
I would hate to see us go from opening things up to having to close them. having it get so bad that things have to be closed. So I guess I'd like to see us have a criteria, sort of step down criteria, so that we can fix, the town can fix something smaller, nip it in the bud perhaps, instead of letting it go till it's really a bad scenario, should it get to be that bad, which I hope it won't.
Okay, Terry Ann?
So, you know, I think the simple, what we're trying to achieve is behavior change. And we haven't really, we've got signs and everything, but we don't have a really good messaging way of engaging everybody in the community to do it. And we want to achieve 70 to 80% compliance with social distancing and wearing a face covering if you can. That is what we're trying to achieve. How we get there, and Bob, you spoke about implementation. I think about implementation a little bit differently. Implementation can be making recommendations about what are some of the things you can do to achieve it. Then the town has to decide what they actually can do and will do. That to me is implementation. What the town, but it doesn't mean we shouldn't make recommendations and have ideas. And we get great ideas on our email box that comes in. There are wonderful ideas and people volunteering to help. So I think that we can make recommendations about what are some of the things we can do to achieve these two goals. And here are the recommendations. Is there any way we can help you implement them? But I don't think it means don't recommend or offer to help, because everybody here brings some expertise, and there are a lot of people in town who really want to help in a real positive way. When you read that mailbox, if you go through it, you will see lots of ideas and lots of help. Monitoring, I think, is another issue. There are a couple other things we could do to objectively monitor how we're achieving that. One would be still cameras along Marginal Way that take photos at certain times of the day. I know they've been used before. Another possibility would be to consider, and Matt probably knows more about this, to consider using a drone when the beach gets really busy so we can see if people are social distancing, and to discuss what are some of the options if we aren't moving along. Not all of them, but what are some of the options we could consider? Maybe one of the options would be if we can't gain your cooperation on these things, we may have to close the beach at high tide, or we may reduce the amount of parking spaces available, and then that will limit the number of folks who can go onto the beach. We don't have to open everything and shut it down. There is a phased way that we can move forward on this. So I think we ought to make recommendations for implementation. We haven't been told not to. We're told not to think that we have to, that we should implement, but that doesn't mean we shouldn't make recommendations. That doesn't mean we shouldn't provide ideas for how things could be monitored. The data that Becky and Kent suggested are ways to monitor, but we could also have some objective ways of looking at what's happening. So that's all I want to say.
Okay, any other comments on this? Okay, seeing none, we'll move on. Charlie?
I'm wondering if anybody's thought about, in watching the press conference yesterday with Commissioner Lambrew from DHHS, she mentioned a couple of grants, federal fund grants that they got. One of them was for $7.5 million, and that's why and how they're increasing the contact tracing. She also mentioned a couple others. We have David Riccio at our disposal here in the town of Agunquit, who's very good at writing grants and looking into areas where we might be able to get some money. Possibly some of those funds could come our way to help us with signage and things like that. So I'm just throwing that out there at this time to see if, see if there's any interest in that and if it's possible.
Okay, thank you. I think I'm hearing good ideas. I hope, Terry Ann, you don't think that I don't want recommendations. I would hope that we make recommendations, but I think they need to be more specific and they need to be, we're certainly going to we're going to at least put on a motion to revisit phase 2 and phase 3. If we decide not to go in that direction, that's okay. That's going to be a vote. I can assure you that's going to be a vote. And that would be a recommendation. Other recommendations that we have based on good ideas, I have no problem at all bringing any recommendations that you guys want to propose to the select board. As long as we agree in a vote that that's the recommendation we're going to make, we can do that. I have to say, in this situation, the town is pretty much loaded up with things to do, and I think we try to we try to understand what they can and can't do. I mean, I would like to have cameras along the marginal way. That'd be nice. That'd be good for monitoring and see what's happening. But I personally can't believe that could ever happen, given budgets, people, buying cameras, doing all that thing, and then who's going to look at them? Those are facts. We have to, debate those facts. I mean, again, great idea. Not sure that can be accomplished. So please don't misconstrue. I want recommendations, but we also have to know what we're dealing with. And I'm interested to take some steps towards helping in implementation, but enough said, I think, on that. Next is business. And Alice.
Okay, I can echo a lot of the things that Buzzy said, since Buzzy's also on our business subgroup. So there's a little bit of sharing between those two subgroups. But we started talking about congestion and how do you deal with potential congestion in town. And we very quickly got to the point that, we don't know what we don't know. There were a lot of fears going into Memorial Day weekend that we were going to be swarmed, and, the town was very quiet. So we talked about, rather than, promote more positive energy and taking an educational tact, both with our guests and our residents and our businesses, but, creating a culture of following the two primary rules, the ones about social distancing and the ones about, covering your face. And again, I saw something in the chat room about people saying not a lot of people wearing masks this weekend, but our understanding is that if you're outdoors and you can socially distance, you don't need to wear a mask if you're walking on the beach. So I don't think we need to be concerned about people safe social distancing and not wearing masks. That's okay. But if you're, waiting line somewhere, probably should have a mask on. If you're walking on margin away, probably should have a mask on. So, we are cognizant of that, but we think the best approach is to, promote to guests that, we're glad they're back, but we need to keep our town safe. So we hope that they respect these two rules, social distancing and masks. And that we also work hard to educate the business community. And I think most responsible businesses are already ahead of the game on this one. But if they're not operating in a safe manner, they're not going to have any guests. People aren't going to return to a place where they don't feel safe. So I think it's less of a lift to educate the businesses, because I think they're very cognizantly aware of following the guidelines and ensuring safe businesses. So, let's show some trust. We talked about where our target audience comes from, and it's primarily New York, New Jersey, Mass, Connecticut. There's a pretty ingrained culture of wearing masks in those communities. We don't have a big influx of people from, I'll pick Texas just because I have relatives that live there. People in Texas aren't really wearing masks. So, here in New England, it's probably more accepted and more common, and people are more comfortable with it as part of just everyday life right now. So, to that point, Kent referenced the chamber signage program that we're working on that we discussed at our recovery committee meeting yesterday. So we are developing branded signage for the Gunkwit community. The signage will be available to all businesses in Gunkwit, not just chamber members, but everybody. There will be some protocol to how to obtain the signage that we're working through right now. But again, the signage is wear a mask, social distance, wash your hands frequently. We've also worked with Kent volunteered the Playhouse's sandwich board signs and the locations that are traditionally given to the Playhouse during the summer for us to develop signage that will basically be a welcoming overtone, but remind people that we're all in this together, and that in order to be able to keep welcoming guests to our town, everybody needs to respect each other and follow those 2 rules. So we've got some of those plans in place. We'll have more information coming out of the chamber on that probably by Friday. I just need to have time to pull my team together and get ourselves organized on that. And the chamber is also planning on polling businesses regarding their plans right now for public space. We talked about businesses either on Main Street or in the Cove, where it could be potential congestion points. There's a lot of hot spots around town where if it does get busy, that a lot of people tend to congregate. But I'm quite sure that a lot of the retail businesses I've spoken with that are engaged chamber members that I talk with a lot, they have plans for how to have people line up to get into their businesses while they wait. So we're going to take a poll of the members to try to get a sense of where are they planning to put their people. I'm sure the businesses that are located near each other have probably talked to each other about how we could organize the line. Like, should I go this way? Should you go this way? We're a community of neighbors, and I'm sure people are talking to their retailers on either side of their operations. I think that primarily covers it. Obviously we met earlier today before the governor's announcement came down. So now there's, also that thought about how do we help the businesses that now, the restaurants that now won't be able to open, that don't have, privately owned parking lots or, lawns that they can spread out at. That's probably something that as a business group, we need to start to work on pretty quickly. And let me see if there's anything else. I did attend Commissioner Johnson's, the first half of her weekly Wednesday conference. It starts every Wednesday at 3:30. And she really didn't address, she kind of re-emphasized what the governor had said at 2 o'clock. Talked about that the governor is encouraging towns to close streets or get creative about creating more outdoor space so that their businesses have an opportunity to open. And that there is no definite date by which restaurants in York and Cumberland County will be able to open. So I think that's something that we really need to pay attention to and get creative about. Take some planning, but hopefully we can come up with some creative solutions. And I would invite, I know we wanted to ask Matt about parking plans, and again, what the PD may have been thinking about this morning when restaurants were reopening, maybe a little different now when these restaurants are going to continue to operate either outdoors with takeout and delivery. But we were just wondering if there could be an update on kind of, the Cove right now is all 10-minute curbside pickup. As retailers start to open on June 1st, have there been conversations with the retailers in various parts of town about changing over some of those 10-minute curb pickups to 30-minute parking again, like in front of, Flips and kind of that block where Still Home Jewelers is, where Guncoat Remedies is. And if, just kind of get an update on that, and if we could play some kind of role in that in figuring out what's fair and equitable so that both businesses all have some access.
We are doing that, Alice, just so you know. I'm not sure I was supposed to answer, but yes.
Oh, no, I wanted you to. Yes, thank you.
When the June 1st comes and the stay-at-home order is lifted, those spots are going to be transitioned back to their 30-minute time limit. And the spots in Perkins Cove, right now, we're planning to extend the amount of 1 hour spots. There's just 4 or 5 right now. We're planning to extend those to more than 4 or 5. And on June 1st, it will go back to regular restricted parking down there as far as time wise. As far as charging for parking, I haven't had that. We haven't had that discussion yet that I know of. It's a metered lot again with visitor services down there. So I'm not sure. I'll find the answer for you, but I saw the question in the chat too. So yes, there will be more longer duration spots in Perkins Cove, both short term and then June 1st as well. And everywhere else too, Alice. The ones on Main Street and whatnot will be going back to normal.
Okay, so thank you. So if a business that was expecting it to be able to open indoor dining and is now just doing takeout or curbside, should they get in touch with you about any questions they have about make sure that their guests still have access? I don't know.
Yeah, we'll
It just occurred to me about this.
Yeah, so it's certainly a new wrinkle
Yeah.
in things because sort of we were anticipating not having to worry about curbside or not having to be as frequent, but we certainly
Right.
want to be able to make accommodations for those businesses that are particularly more impacted now that they're not allowed to have limited in-person dining. So I think that's we'll probably have meetings on that, and we'll loop you into Alice. Any ideas, because we're very limited for parking spaces as it is. But I certainly would love to make accommodations for that to still continue and to accommodate the other businesses that need a little bit longer term parking.
Okay, great. Yeah, thank you. I'd love to be looped in on that.
Thanks.
Buzzy or Rick, did you have anything you wanted to add?
Okay, Alice, thank you. So I did hear you say you might be taking up the question of public space and how that might be utilized. Obviously, that's not something for today's discussion, but you will be taking that up. Be interested to hear how that goes, because that could be a future recommendation to the select board. It might also be a way to incorporate town density issues into the discussion. I think that was something Terry Ann spoke about earlier when we were offline. So be interested to hear about that. All right. Now we're up to beaches, which is for all of us to discuss. So I want to put up the phase 2 recommendation that we approved originally or in a prior meeting. So it's going to come up here in a moment. And Matt, you're going to drive this?
I was gonna, do you see it, hopefully?
Well, we see it in the working form. You need to go to slideshow, I think.
Okay, I just want to make sure you could all see it
Yeah,
for
we can
last
see it.
week's experience. How's that?
It hasn't come up at slideshow yet. So I think it takes a while to, we could probably go to, okay, we still see it as in the working document, which is fine. If you can scroll.
All right, I did change it to page 2. So I'm gonna stop sharing it again. And I'm gonna try again.
Okay.
How about now?
Oh, that's nice. It's going to buffer a little bit. It's phase 1. Can you go to the next slide? Because we're not going to talk about phase 1. We're going to talk about phase 2. Next one, please. All right. Back one. Okay, just as a reminder, what we had approved in a prior meeting, I don't remember the date of that meeting. It's not run together now. So in phase 2, we have walking, surfing, paddling, fishing, and swimming. However, it adds chairs and blankets, et cetera, are allowed. 6 feet social distancing in place for non-family units. Social distancing protocols in place per CDC and Maine CDC recommendations. Sports-related activities allowed in designated areas as determined by lifeguards. I guess that could be visitor services or CSOs. Estuary access allowed with social distancing protocols in place. I'm not going to really talk about parking because parking now apparently is being worked on and we're not really working on that. The visitor services people are working on that and we can expect something on parking in June.
Bob,
Yes,
Bob, just a quick one back on sports. When the lifeguards are there, they patrol that themselves. They have things out and they have designated areas for sports related activities. And if you're in there and not in that area, in the correct area, they let you know right away. So.
great, thank you. And we talked about the consideration and needs, which are the same, the right PPE in place, beach users to wear masks when social distancing is not possible. And wanted to build a checklist to support the phase 2, which we did for some in phase 1. We did it for some parts of the process here, but that may not necessarily be viable anymore because the authorities are taking the mandate of the select board and then implementing. Let's go to the next page, Matt. Signage. I think signage has been, it is what it is. The signage guys have got back orders and, everybody in every beach and every town and every business needs signs. So I think, well, again, it's an implementation area that we know that the signage that we need, and we'll allow the town authorities to have to take care of that. And then of course, the select board determines if we go to phase 2 and if we go to phase 3 someday. So I think this was what we voted on. This is what was approved, not unanimously, I'll point out. But the question before the task force, and I can't see all of you now because this is up here. The question before the task force is this what we want to reiterate? Do we want to make a further recommendation? I will say the select board came to me asking me to come to the meeting next week and bring phase 2 as it's been approved by us. They did not take it up. They took up phase 1 and approved phase 1 with a few modifications. Do we want to simply have me take this back to them and have them debate and come up with a date? We didn't put a date in this one. There has been a date bandied about a little bit unofficially, not necessarily by us. June 3rd. That might be okay. It might not be okay, but that's not really for us to determine. So I think everyone's seen this. Matt, why don't we take this down so I can see everybody in case people want to make comments. And I got Buzzy first, Terry Ann second.
I just, did it say the use of the river, right? You said you could use the riverside now. That was okay. I just want to make sure. And one of the thing I would like to add, was it Miss Friedman had that wonderful idea. I think we would have a constant every hour on a loop on the public PA system, mass, social distance, basic, have a nice day. Thank you for being part of the community together. We're in it to win it. We win together, something positive, affirming. And then along with the temperature of the water and, the basic information, but do it every hour. So he doesn't have to come up and do it. We can just trigger it and get that. So it's almost like, it'll be like, Bernie's and Phil's Price. That's right. You'll be singing this song about the masks and social distance on the beach. But I would say for the date, as soon as possible. And that's it. Thanks.
Thank you, Buzzy. I think it was Terry Ann was next.
Yeah, since we passed this, we have some experience now, and we've learned a little more, and we've gotten a lot of comments. So I would like to think about the social distancing as 6 feet works if it's an individual, but if you're a family or a small group, I'd like to see that be connected to the state guidelines that no groups gather greater than 10. and that we have 12 feet apart between groups, unless there's an individual person who could be 6 feet from another individual. Mostly you're going to have groups. So I think we have to increase the distance if you've got groupings sitting on the beach. The second thing I'd like to suggest is we got a lot of comments from families who bring their kids to play, and it's not exactly a sports related activity, but I think we need to be clear that families and children who are digging in the sand and making sand castles and playing in the water, that be part of sports activities. It's not specifically addressed. So those are the two kinds of changes that I would recommend for in the activity section.
Terry, I didn't quite get the second one. Can you just paraphrase that again for me? I'm trying to write it down and
You mean
quite get it.
children playing?
Yeah,
That in addition to the sports related activities allowed in designated areas, or in the first bullet, walking, surfing, paddling, fishing, swimming, that we also specifically mention children and families playing on the beach. It's not really a sport, but they do play on the beach.
so you're basically saying allowing children to play on the beach would be along with walking and all that, the other parts, right?
Yep.
Okay, good, got it. And I did see a lot of chats around that, so thank you to all the chat people on that. Rick, and then Pam. Rick.
Thank you. The governor today, I believe, said that groups of 50 can start gathering as of June 1st. So we have to be careful of what we say. I mean, yes, we want to be careful, and we want people in groups of any size to keep a distance. I think one of the reasons I think this is a positive thing to do is it's much easier to monitor masks and social distance than it is to be beating people up for, not beating people up, that's not a good word, but fighting people about sitting on the beach, relaxing, the kids playing. I think that the sports related, I think the kids playing on the beach and stuff like that is never been considered a sports related activity. I think like we've said, the lifeguards have a certain protocol that they expect people to follow with, volleyball, football, stuff like that, or even surfing has to be at a certain point. So I think once the lifeguards are in, that's going to follow itself naturally. And again, we don't want to overcomplicate rules. The less rules we can have on a sign, the better. So, but the 50 is a key thing that I think we need to remember, that the groups of 50 are now going to be allowed. So we have to be cautious not to overstep or overrule, I guess. Thanks.
Okay, Pam, Rebecca, Pam, and then Rebecca. I think Rebecca, you were first, but I can't watch everybody. So Pam, Rebecca.
I was just going to almost say the exact same thing that Rick was going to say, that the governor's order starts on the next phase on June 1st. It's gatherings of 50 or less. So putting, other numbers out there, I think confuses the public. And the other thing, I was just going to agree with Rick that what we're talking about were the activities, were the volleyballs, were the footballs, were all the other stuff. And that they can't be, actually they can't be in a certain area, and the area they can't be in is where all the little kids are playing. So you don't have to worry about your child getting hit on the board with a football or getting lobbed with a frisbee. So I think we just stay with the regular beach regulations, period. And kids playing on the beach is not an activity, it's natural.
Okay, thank you, Pam. Rebecca.
Just in terms of the lifeguards, JP said that 12 come on June 8th and an additional 12 June 15th. and they do training that week. So they're sort of, in terms of people swimming and safety, they're sort of not in full swing until the third week of June, it sounded like, although some of them are around. And I wonder if there's some recommendation we could do about the main ramp. That's a really congested place, whether it could be one way in one direction and
There
Uh,
is. Rebecca, there are signs. Right
And-
now, there are arrows that you go down one way and you come up the other way, but you have to wear a mask during that, in that area, and it says that pretty
great.
prominently.
The
I don't
markings,
know whether we want a bigger sign to divert. I know there's a conservation issue with the path
floating.
around the Norseman.
Mhm.
But there are two other ramps. I don't know whether there could be signs directing to just to try to disperse people a little bit more than congregating in the front there.
Some of the ramps that are along the estuary are pretty steep. So if you have any kind of physical impediment that you can't walk up and down, they can't do that. Where the ramp by the Nordsman is easier for people to walk up and down. So that's a consideration.
Bob, did you add PA system?
Yeah, I have my notes here. Loop. I got a loop.
Can
And I did
ask
see
you-
lifeguards. I saw lifeguards there on Saturday. I talked to JP at the beach. And JP, if you're out there, send me that email you're gonna send to me because he had a lot of interesting comments and ideas. So if you're out there, or if somebody knows where he is, you can get him my email, that would be helpful maybe. Because he had a lot of interesting things to say. Who's doing that?
I don't know, but JP always has interesting things to say. Matt,
Made sense to me.
Matt, do you always, did you know if they used the bullhorn this weekend at all? Or if they had to?
JP indicated that he was going to try. It's owned by the Norseman.
Okay.
And,
Oh, it is. I didn't know that.
yeah, it's not ours. And they've been very good all the time with letting us use it. Apparently, they updated it a couple years ago, and it has intermittent works, doesn't work issues. So it might be something we look into, seeing what the options are or possibility is of having our own on the bathhouse or on that telephone pole near the beach that we could put on a loop, like Buzzy said, or something like that. That's certainly something we can look into.
Thank you.
So according to Tracy Smith, it says here he did use it and he heard it at the shop, or she heard it at the shop. So thank you for that message. Okay, before we talk, Terry Ann.
This is a little bit just a question. So coming in up and down the main beach entrance, when the sand has covered up the one-way arrows. So I've been there every day for the last week and they're mostly blown and covered up. The second thing I think we have to think about in terms of social distancing in groups of 50. So imagine it's a hot day, 90 degrees, 80 degrees like it was today, midweek, so nobody was there. And people go down the ramp and they cluster around both sides. They cluster there and nobody wants to walk any further. So I do think we need to give more thought to how we're gonna encourage people to spread apart, particularly if you're talking about groups of 50. How are we gonna get people to spread out? And how are you gonna get people to socially distance in a group? How does a group of 50 socially distance from another group? I don't know the answer to that, but I don't want to be flip about it, but I do think we have to think about it.
Alice.
So you're allowed to have groups of 50 in any one place, but groups that are not household members still have to be 6 foot socially distancing. It just refers to a maximum occupancy. Like if the restaurants were allowed to reopen indoor, and they had one large room, they could only accommodate 50 people in there, but non-household members still have to social distance with each other.
So, and I'm glad you brought that up because I thought the 50 was, just as you said, was related to like events that are planned, right? Like a wedding or something where you knew everybody and it was in a building. So that's what I felt where it was applicable to. I guess the question is, it was the same when it was 10. It wasn't beach related. It was more, you can have a social gathering of 10. And now you can have a social gathering of 50. So if you want to have a birthday party with 50 of your friends, you can do that.
You're absolutely
need,
correct.
do we really need to put a line item in here around, 10 people on the beach? Buzzy, you're shaking your head. You want to comment? You're on mute, Buzz. There you go.
Okay, yeah, I don't see the need for that. I think that's part of the social, just general awareness of this, the whole deal of social distance. And if you walk on the beach right there and you plop your chair down right at the bottom, well, then you want to let your freak flag fly. You're gonna run the most interference with as many people as you want. So you do you. Now, if you don't want to, you walk far away. You know what I mean? We'll see the spatial, past the volleyball, into the G section, into the before little fields, you know what I mean? All that stuff, you'll find your space, and people work this out themselves. So no, I don't think that. And that's it. Yeah, thanks.
Okay, so I have seen that in the media and other beaches, the 12-foot rule seems to be pretty common. So I don't seem to have that seems to be consistent. So I would say that fits in. Understand the children playing angle. A lot of comments on that fits in. We're not going to take a motion now because it's not in the agenda that way, because we are going to hear from the public first, and then we'll come back to any motions on any topic that we wish. Is there any more commentary on beaches before we move on? None. Buzzy.
Fishing on the bridge. Is that in phase 2? They're going to allow fishing on the bridge? Because of all the rules that are being like marginalized, that one is the mothership right there. And so if we take that off and just allow people who are going to fish, you social distance them and allow that, then we don't have to worry about that.
Well, I'm glad you brought that up, because fishing off the bridge, to my knowledge, and I know I'm going back a long way here, some weeks ago, fishing on the bridge was never disallowed because we don't own the road and we don't own the estuary. So I don't know. Matt, I don't
We've
think
never
we ever
prohibited fishing on the bridge. Not
Right.
the main beach bridge, the footbridge, they go across the footbridge, or people
Yeah.
sometimes throw a crab bucket in or something, we have, but not the main beach bridge.
Yeah. So I'm, I hate to get into the legal stuff, because then somebody goes and becomes part of the legal stuff, and then it just sets us back. I agree with you, but there was if I saw I only went down there for a little bit. If I made one point, that was that walkway with the fishing was tough. I also saw the estuary as not being that big a deal. So there was one good and one bad. But I don't know how we get around telling people that they can't fish off a bridge that we don't own in the town, unless there's an emergency declaration, I guess, but I don't see that as happening. So it's a good point. Okay, I think we had a lot of commentary. We're up to almost 2 hours. I would say item number 6 was task force member comments. When we're at the end, maybe if there's anything that we want to talk about to go forward with something, I would like to open up for public. Is that okay with everybody? A little nod of the head? No issues? Okay, thumbs up over there. So let's start, Matt, with anyone who has their hand raised. And
Right now, there's none. If you just
Okay.
want to ask them to raise their hands, that might prompt them.
yeah, if there's anyone out there that would like to raise their hand.
We have
Jordan?
Jordan. Yep, Jordan Friedman. There you go, Jordan.
Okay. One thing that I forgot to mention before, I have the option of sending out an email blast. And I can reach about 530 odd email addresses. Now, this I usually use for select board meeting agendas, planning board meeting agendas, news and announcements. People sign up and they pick the names of what group they want to hear from, employment, job opportunities. But I can gather all of them together and we can send out a blast of 500.
Thank you,
So-
Jordan. I like that. That would be a big communication tool in terms of education, some basic stuff. I mean, let's not, get too complicated here, like we've been saying, but that would be great.
Yeah,
Do we have to have Pat okay that before it goes out?
yes.
Okay. Why don't you and I talk offline and I can put something together and maybe we'll just, from what we're talking about today. All right?
Okay, your porch or mine?
Your porch.
Okay.
No, I got more social distancing on my porch.
Okay,
Okay.
all right.
Okay, thank you, Jordan. And in the chat room, I'm just looking at a few, if anyone sees anything they'd like to comment on or answer. But before I do that, there's one thing that's been happening that I want to say thank you to Rick. Rick has been taking most of the comments that come onto the website, and then most of them he's responding to. I've responded to a few, Pam has responded to a few. If it's okay, Rick, I would still like you to be the clearinghouse, but that doesn't mean you need to respond to everyone. You should, I think if you look at them and you funnel them off to the appropriate person on the task force. So if it's a business question, it goes to Alice. If it's a medical question, it could go to Rebecca or Terry, et cetera. That I think we owe it to people who ask or make good comments, or not good comments, but just meaningful comments, to give them some response. So you can have bad ones too, good and bad, but meaningful ones that will help solve our issues. So if that's okay with everyone, again, a little nod would be good, so I don't have to go through all the, and if Rick, you're okay with that, and then you can, I appreciate that. I saw one here. Is there a rule about people setting up tents? I don't know. Is there a rule for tents on the beach?
There is not, that's what I was gonna ask Matt, actually, that question. I don't think we have a rule about tents. I mean, obviously no tents overnight, but I think what Bobby means is tents, some block. But I think we've been talking about pretty much whatever is a normal expectation on the beach is what we would like to move forward with. So I think Matt, is there any rule about tents on the beach?
No, we have not like the recently enacted restrictions in Wells that they did. We have no overnight, like you said, but other than that, there are none.
Okay, thank you. Alice, I have one question. Since the governor has made her little statement today about restaurants, internal usage, what about retail? Is it still what we're expecting? So there's been
Yeah,
no.
retail's fine. Retail's unaffected. So it's still, the retail operations can open on June 1st. Most of our businesses in town are very small, less than 7,500 square feet. So the current number of guests you can allow into your retail store, if you're less than 7,500 square feet, is 5 people. And that does not include employees. So that's about the extent that you can have in your business right now. Commissioner Johnson, I know that the Retail Association was optimistic that that number would be increased. But someone asked Commissioner Johnson that today, and she said they basically are going to allow the retail operations to open on June 1st and see how it goes. And that if things went well, which they expect it will, because we all have a lot of experience with walking into Hannaford and other retail stores that have been open for all this time, and people have an understanding of how to behave, that they may increase the occupancy for better. I'm sure it's not called occupancy limits, but the number of customers that are allowed in the store at any one time. But retail's unchanged, so retail can still open. It was only indoor dining at the restaurants that was affected.
Okay, thank you. Charlie, oh no, Pam, I'm sorry.
I have a quick question for Alice. Was there anything said about houses of worship?
No, I didn't listen to the whole press conference. I mean,
They can open up under 50 June 1st too, so I was,
Yeah.
so, okay.
Yeah, there was no further conversation about houses of worship today.
Thank you very much.
As
Okay,
far
so
as
we
I
got a
know.
chat.
In full disclosure, I didn't listen to the entire press conference, but I haven't seen anything coming out of it about that.
So in the chat room here, from Joan Griswold, the Preservation Fund has agreed that we can monitor mass compliance and congestion from their camera on the lighthouse. We can get volunteers to monitor the camera for short periods of time periodically to compile info. So we don't need additional cameras. So that's from Joan. So Buzzy.
Yeah. Bob, JP sent me a text. He said he sent you an email yesterday morning around 9:20. So you might want to check it. He sent me a text that's really brief. And but it leaves a lot of information that is important to what we're talking about because he's the frontline guy. And then also whatever motion we could all say, hey, let's start wrapping it up because we're doing really well here, but let's get outside and get to the beach or something. Or
Okay, got it. Thank you.
you'll love it.
Send him my email address because I would, if I'd gotten one, I would have been paraphrasing it today already. So he may have sent, I gave it to him, but he had to memorize it.
I will call you when we get off, or I can tell everybody your email address right now on the Zoom.
No, don't do that. Although it's already out there. I don't care. Go ahead. You could do it. Go ahead. What the heck?
Is it
I got
Bob White 74 at Gmail?
Wrong.
Okay.
rwhitelaw74@gmail.
Wait, yeah,
AP.
B Whitelaw 74 at Gmail.
No, rwhitelaw74.
There you go.
Arr.
I will send it away.
Okay.
Thank you.
Okay, so we're gonna move then on to motions. Other than the beach, are there any motions other than the beach? I'm not sure. I heard one developing. I entertain any now if you remember, these are motions for recommendations that we would take next Tuesday. And we have this now period of time, the way we're organized. So even if we get this motion worked out here and we see something wrong with it, or we can still have time to amend it, even though we need to do that in a public area, but it will be the motion or the recommendation will be public on Tuesday. So I would say that we go ahead with phase 2 with the following amendments: that social distancing on the beach for people who sit is 12 feet. We can add the verbiage around children playing. Is there anything else other than the 10 and the 50? I'm not sure that is really applicable to the beach, in my opinion, but
I would not like to see the motion in there about children playing. Children are children. I think that makes us look really silly. I mean,
okay.
a child with a bucket is a child with a bucket. Come on now.
Well, Pam, we've gotten lots and lots of questions and comments about that. That's the only reason I wanted to make it clear in our recommendation. So we have gotten lots and lots of comments about it, and I wanted to make sure that people understood that it was fine. So
But we're going back to the original opening of the beaches the way we had before. We're not changing anything. So they've always played on the beach. that was because the beach wasn't open before and they were supposed to keep moving. I think that's why we got the comments, my personal feeling.
Okay. So then basically the only addition, and maybe I'll put some verbiage in around traditional beach activities. I don't know, making sandcastles. 12-foot social distancing is the amendment to our original recommendation. Any other amendments to the original recommendation?
Did we want to say the PA system, or that's up to the lifeguards and the police?
Yeah, I think that's tactical, and Matt took that, and yeah, I don't think that, I
Okay.
can mention it at the meeting, just as a, this was discussed. I try to weave other stuff in, but as a recommendation, I understand it. I think that's important. But for this recommendation, and I could put it in there if you wanted. No, okay. So, do I have a motion then to reapprove phase 2 recommendation with the amendment of 12 feet social distancing?
Aye.
Buzzy moves
Motion.
and Charlie seconds. All those in favor say aye.
Aye.
All those opposed? There's no opposition to that motion, so I'll be bringing that recommendation to the select board next Tuesday. One final comment, and it came just up here. North Beach, people keep talking about North Beach. For us, North Beach is a parking issue. If you were on earlier, Matt addressed that, and parking is now completely in the control of town authorities. And we'll leave it to them to decide when parking is opens and is open for a charge. So I don't want to really talk more about parking, and I think that's what really affects the North Beach access. Okay. All right. Do I have a motion to adjourn?
What are we
Charlie,
doing? What are we
make-
doing next?
Huh?
What are we doing next?
When are we meeting next? Okay. Next meeting is next Wednesday. So if you saw I think one of the emails came from Matt. He lined up all the meetings until like 2023. So, we'll be here for a long time. No,
Do we want to discuss the agenda?
what?
Do we want to discuss the agenda for next week?
If you'd like to, before we move to adjourn. You have the floor, Rebecca.
Well, I'd like to see us work on criteria for, not just taking in the monitoring information, but actually developing a plan for, what are the markers that we're looking for? And what actions might we take depending upon what we're finding and what the appropriate people are telling us?
Okay. I have that on my list here. I'll put that into the next agenda.
Thank you.
You're welcome. Any other? Charlie?
Just a quick comment. Are we going to talk more about marginal way, or is that not part of our purview anymore?
Well, we made a recommendation and the select board debated and made a resolution and approved it unanimously.
Okay, so
So-
we don't have to bring that up again then, huh?
Not
Okay,
until,
good.
yeah, I think not until we see, and maybe that speaks to Rebecca's point, we'll see what transpires. So
Okay, thank
far, I think, I appreciate that. Okay, so any other agenda items? If you have agenda items, as I'm trying to get better and better, bring them to me and I'll get them into the agenda to the extent that I can. And if you have any thematic ideas as well. Do we have a motion to adjourn?
We already did, didn't we?
Okay, Charlie, you were right, but then I forgot who it was. So Charlie, thank you. And Buzzy, you are the second. All those in favor, raise your hand. All
Thank
those
you, Bob.
opposed?
Thank
Very
you.
much.
Thank you,
Have a
Bob.
great-
Thank you, Bob. Thank you.
Bye-bye.
everybody.
Thank you. Thank you, everybody.
Thank